Hi, I'm Dr. Mary Shackleton. Welcome to this interview. Today I'm here with Gianfranco Fino and Donatella Fino, and they are both lymphatic massage therapists there in Boulder, Colorado, and we're going to talk today about the importance of the lymphatic system. As having been in medical school, there's a big hole in our understanding about what the lymphatic system is and how important it is, especially for detoxification. So I'm so pleased to have you here today, the specialist that can talk to us about the importance of the lymph system and how to manipulate lymph for better detoxification. So tell me a little bit about the lymph system itself, the anatomy, and how toxins exit the lymph.
The lymph system is composed of about 800 lymph nodes. A lot of them are primarily in the abdomen, but you have them throughout the body. And the vessels are right underneath the skin layer, so they're above the musculature. And the size of these nodes range anywhere between a sesame seed size to a grape size. And working with the lymph system, you're able to grab that intracellular fluid, put it through the ducts, and then you're able to excrete that and detoxify it through urine and sweat.
And can you tell me a little bit about what the difference is between a regular massage and a manual lymphatic drainage?
Yes, so a regular massage is really focusing on the soft tissues of the body, more like muscles and connective tissue, even harder tissues like bones and ligaments. Whereas a lymphatic drainage treatment utilizes the skin, and so the therapist will start stretching your skin systematically or through a protocol to start influencing the lymph circulation to start moving out of one area of the body and into another area.
I would imagine that there's a lot of confusion about what a lymphatic massage is or manual lymphatic drainage and massage. Like, so what's the difference if you're the person on the table and you're getting manual lymphatic drainage? What's the pressure like, and what's that person going to feel, and how is that different from a traditional massage?
It's very light. So we're used to going to a massage therapist, and whether you want lighter pressure or deeper pressure, you're pushing into the tissue and you're manipulating the tissue, versus a lymphatic drainage session is more of a skin stretching technique where the pressure is about 1 gram of pressure. Think the weight of a nickel on your skin. That's as light as you go. Certain areas you might go a little bit deeper when you're pumping certain lymphatic organs, but essentially it's a very light massage, very light session, and there is no lotion used.
Oh.
So you really need that friction with the skin.
Yeah.
Okay.
If you think about it, a massage therapist, when you go into the body, you are kind of compressing these subcutaneous lymphatic vessels. So that's the difference. So again, that gram of pressure, you're keeping those lymphatic channels open for that fluid to move.
Okay, so I just want to create a visual for people that we have chains of lymph nodes, and between each lymph node is a vessel, and that's how things flow through the body, is through the nodes, which I think of as cleaning stations, and then it gets transported through the vessels and then interfaces with the capillaries so that it can be eliminated through sweat and urine. Is that pretty much
exactly
how it works? Okay.
You could think about it like a train track, and it has different stations where you have all this lymphatic anatomy that moves it from one stop to the next, or like a highway system with a bunch of exits. And that's kind of how I describe it to some of my patients.
And it's incredibly critical. So we know when patients have lymph nodes removed, if they have a mastectomy, for example, then they're compromised. Their ability to move that fluid is compromised in that limb, and they might have lymphedema, which I'm sure you work on all the time.
Right,
Yes.
right. They say that if your lymphatic system stopped working, you'd have 24 hours to live.
Oh, so see how critical it is. Super critical. So we're going to show you a quick video where there's actually a manual lymphatic drainage session happening, and a near infrared camera is capturing on video what it is. So can you walk us through a little bit about what we're seeing here on this video?
Sure. I believe you'll see a little plate, that's the ankle. So it looks like this person may have had some ankle surgery, which could be why they're having this session. And you will see at the beginning of the video, nothing is really happening, but you have this green line, and then all of a sudden you will see almost like shooting of this green fluid go up through the leg, through the shin, and that is actually the lymphatic fluid. The practitioner is down towards the ankle, literally moving the lymphatic fluid up and out to a node where then it can get filtered throughout the body. And I think if you kind of look at the bottom of that video, you can see a little bit of movement, and that's actually the practitioner's hands working on the leg.
I think it's fascinating.
It's one of my favorite videos.
And I think we need more information, really, some scientific studies to help us prove how important this system is.
Yeah.
What are some causes of an overburdened lymphatic system?
Some of the causes are illnesses. So they could be just regular illnesses like colds and flus, or something more serious like an autoimmune condition. Trauma to the body, surgery. Those are some of the causes that block the movement of lymphatic fluid.
And how about toxicity? It would be a big one in my mind. You see that? Can you tell if somebody's toxic when you see them?
You have ideas. So I'm looking at the skin color, I'm looking at the overall appearance of a person, and obviously the edema that the body is holding on to. So sometimes when we get really toxic, you'll hold on to a lot more fluid, and that's clearly an indication of a compromised lymph system.
So edema is one clue that you might need,
Right.
Obviously manual lymphatic drainage, but also detoxification.
Right, right.
Tell me a little bit about your background and how you became lymphatic therapist.
Well, I became a massage therapist in 1999, and after many, many years, I was looking at the body and feeling like there was a piece missing. And I knew about the lymphatic system, and I had an interest in it. And it wasn't until my knee injury in 2009 that I was like, what a great time to learn about the lymphatic system. I had a swollen knee, I came out of surgery, and I wanted to get better much faster and get back to living an active lifestyle here in Colorado. So I saw a lymphatic therapist for my knee, and my knee, I walked in one day on crutches. I was in a lot of pain, and literally that day I walked out without crutches. And so it was from that moment on that I was like, I need to do this work. And so I went to close training here in Lafayette and pursued lymphatic drainage in 2009. And since then I became a lymphatic therapist.
And it's great to have you in this community as a referral. So I love to send patients for manual lymphatic drainage because it's so important in the work that I do, and it really does make an impact on their improvement and recovery. And tell me a little bit about how you came to be a lymphatic therapist.
I actually was the recommendation of my brother. After high school, I wanted to go into medicine, and he said, why don't you become a massage therapist first, come out to Colorado. So I came out to Colorado, I got my massage therapy certification in 2002, and then I went back to the East Coast and I got my undergrad, thinking I was going into the typical medical field. But because of my massage therapy background, I wanted to do something a little bit more alternative, complementary, and he had already gotten his lymphatic therapist certification, and he said, you know, close is going to be in Connecticut, and it's right before you move back out to Colorado. Do that. And I have a very big interest due to personal reasons with breast cancer specifically, and I've always wanted to kind of work and help those women who are dealing with that. So I went and took this course, and it just changed my view of how the body works. And so I came back to Colorado and joined forces with my brother. And
Great,
you know,
brother-sister duo. Awesome to have you in the community. So tell me, when should somebody come to see you? What are some of the reasons that somebody would come to get lymphatic drainage?
There could be many reasons. Here in Colorado, a lot of people love to be just living the life and being healthy, and so a lot of us take on some detox plans, like maybe come spring you want to clean out your body. So that would be a great indication to come on in for a lymphatic therapy session. So perhaps coming in before you start your new diet, clean out your system, go on your nice clean diet, and in that month that you're on this clean diet, maybe coming in 1 or 2 more times just to continue removing cellular debris, so to speak. Other instances where you would want to come see a lymphatic therapist is any sort of edema issue. My knee is swollen, or I have a swollen ankle. Why is that? You may or may not know, but that is an indication of something is going on with the lymph system. Cancer treatment. Anything else?
Post-surgery, whether it's anything orthopedic or even a plastic surgery. Sometimes people get things done on their face and it'll swell and the surgeons want it down. Also, I also recommend people to come around cold and flu season. So before cold and flu season happens, start to work your lymphatics. Start to get your immune system really working for you instead of trying to keep up with it when you start to get sick. And so I think coming around those times, like the changing of the seasons, and a lot of times people will also detox around that time too. So I think changing of the seasons, when allergies, any kind of inflammation might show up, or flu and cold, you don't really want to be susceptible to that. So come in, let's get a boost on your immune system.
I think that's really smart. As I'm really focused on prevention, and patients always want to know, if I'm not going to get the flu shot, what should I do? And now I can say, consider this. What about pregnancy? Would you recommend it for somebody who's pregnant?
Absolutely. During pregnancy, a woman has 50% more blood volume in the body, and that puts big stress on the circulatory system. So to help remove some of that fluid from the lower body, as pregnant women will know that the longer that they're on their feet, the more that they'll swell. So lymphatic drainage is one method of removing that fluid. And the other good thing about coming in to see us is that we are decongestive therapists, so we work a lot with compression, and we utilize a lot of stockings or compression stockings to help keep that fluid from coming back into those parts of the body. So whether it's pregnancy or other reasons, for seeing a lymphatic therapist, we can put this together for you.
Okay. Is there ever a time that you would not get lymphatic therapy?
One of those times would be an infection. But off the top of my head, I remember this one time where a woman came in to see me, and she had, it seemed like she had quite a bit of edema in the lower body, and I would work on her, and she'd come back reporting like she would be a little bit more sick. And in that instance, I knew something was off, because that just didn't seem like it was connecting dots for me. So then I referred her to you, and we found that she had Lyme disease. So I thought it was important to have that Lyme disease treated first, so that we're not constantly disturbing the muck that's kind of within the body and making someone more and more sick.
Right, which can actually happen with a chronic infection, because those people don't tend to detoxify well. Those are the people I want to send to you, and then sometimes it's too early in their treatment and they get sicker from it. Right. And also I find that when, Boulder is a very detox-focused city. People love to detox here, and I tend to see people in January and February who've gotten sick on cleanses. And so I think that there is a certain amount of toxic burden in the body that lymphatic drainage and therapy can actually probably stir up if people aren't prepared, if they're too toxic.
Completely agree.
Yeah. What about essential oils? People love essential oils. Would you recommend anything to support lymphatic health?
Yes, I have found that more of the citrus type essential oils like grapefruit, lemon, and also lemongrass actually help stimulate the lymphatic system. I've actually had a primary lymphedema patient, had fibrotic tissue on her lower leg, and she was the one who asked me about it, and I did research, and I found these types of oils, and she put it directly on her fibrotic tissue, and it actually helped. And then she said she actually felt better, like the leg wasn't swollen as much, so it actually helps stimulate the lymphatic system.
So that's lemongrass, lemon, and grapefruit. And where would you put that? If you were just, it's a harmless thing to recommend for everybody, but so what's the best place to use that?
Probably behind the ears, where you can use it aromatherapy-wise, and then directly on areas where you might have that fibrotic tissue due to a lymphatic ailment.
Or perhaps the bottom of the feet.
Okay.
Yeah.
Great. So we know we absorb everything through our skin. So if we're putting that on the bottom of the feet, it's going to work its way up through the lymphatic ducts and channels. Thank you so much for being here today. So great to get to learn a little bit more about the lymphatic system and, to support my mission to teach people about how to detox better and safely. I can't wait to get on your table. I'll be calling you immediately. And if you'd like to learn a little bit more about lymphatic therapy, you can go to plovehealth.com to look at their website. And then do you have any way, if somebody's not in Boulder and Colorado, how would they find a lymphatic therapist?
There's a great website called lymphaticnetwork.org, and that covers lymphatic therapists throughout the entire country.
So you could go on there and see if somebody's in your area and
Yep.
experience lymphatic therapy.
Yeah.
Great. Well, thanks again so much for being here.
Thank you for having us. It's been a pleasure.